Lung infections. A lung infection occurs when a bacteria, virus, or fungus invades the respiratory system, causing inflammation. Lung infections can lead to pneumonia, or an inflammation of the alveoli, or bronchitis, an inflammation of the bronchial tubes. Some common lung infections are bacterial pneumonia, influenza, and tuberculosis. Pneumonia is an infection that causes the alveoli to swell and fill with fluid or pus. The alveoli are the air sacs in the lungs that are responsible for air exchange with the blood. This fluid and pus will cause a cough that produces phlegm, fever, chills, and shortness of breath. Pneumonia can be caused by a variety of organisms, including bacteria, viruses, and fungi. Pneumonia can be fairly mild, or it can be life-threatening. Clients most at risk are infants and young children, older adults, or people with chronic conditions or weak immune systems due to health problems or certain medications. Symptoms of pneumonia vary based on the organism causing the infection, the age of the client, and the presence of chronic conditions. They can be chest pain when you breathe or cough, a productive cough or coughing up phlegm, sweating, fever, shaking, and chills, a low body temperature in older adults, shortness of breath, fatigue, confusion or changes in mental status, particularly for older adults, or nausea, vomiting, and diarrhea. How can the home health aide help? You can help by encouraging your client to drink lots of fluids and get lots of rest. Ensure that they take any prescribed antibiotics and at the correct times. Monitor their vital signs, including temperature, pulse, respiratory rate, and blood pressure. Call for emergency services if you find your client disoriented, hallucinating, if they have a low blood pressure, which is under 90/60, if they have rapid breathing or breathing higher than 30 breaths per minute, if they're severely short of breath, or if their heart rate is severely low, under 50, or very high, over 100. Influenza is a viral infection that occurs in the entire respiratory system, the nose, throat, and lungs. For most people, influenza will get better without any extra treatment. But for some, like elderly people, young children, or those with weakened immune systems, influenza can be deadly. The symptoms are a high fever, body aches, headache, a non-productive or dry cough, extreme fatigue, sore throat, or eye pain. Tuberculosis is a potentially serious infection that mostly affects the lungs. It was once quite common in the USA, but is now quite rare outside of certain populations, such as indigenous communities, people with HIV or AIDS, people who use IV drugs, or visitors or recent immigrants from countries where TB is common, such as several countries in Latin America, Africa, Eastern Europe, Russia, and Asia. Tuberculosis can infect your body, but your immune system may prevent you from getting sick. Tuberculosis is only infectious if you are sick. For this reason, TB is differentiated into two types. Latent TB, where you have TB, but the bacteria are not spreading in your body and you have no symptoms. You are not infectious. Or active TB, where the bacteria spread and you're sick and likely infectious. Latent TB can easily turn into active TB and can occur weeks to years after the infection with the tuberculosis bacteria. Symptoms of active tuberculosis are cough lasting more than 3 weeks, coughing up blood, chest pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, or loss of appetite. How can the home health aide help a client with tuberculosis? If your client has active tuberculosis, you must protect yourself using the appropriate PPE for an airborne virus, including a properly fitted N95, eye protection, gloves, and gown. If you have not had a recent mask fit test, speak to your supervisor and ask for a reassignment. The medications used to treat tuberculosis have unpleasant side effects, and your clients must take them for a long time, as long as 20 to 30 months. Because of this, many people stop taking the medication or don't take it as prescribed, and as a result, tuberculosis is becoming resistant to the drugs used to treat it. Ensure that your client is taking their medication and help them deal with side effects.